Welcome to the Health Workforce Technical Assistance Center's webinar series. This webinar is entitled Program Evaluation. What is it and how can you use it to improve program performance? Part 2. And it was presented by Amanda Norton and Robert Martiniano on September 28, 2017. Hello, my name is David Armstrong and I'm the Director of the Health Workforce Technical Assistance Center. Today's presentation focuses on program evaluation, and it's the second of a two-part series. But before we get started, let me once more introduce our presenters. Amanda Norton is a quality improvement consultant who has been working in the field since 2009, and Robert Martiniano is a senior program manager at the New York Center for Health Workforce Studies. And with that said, I'm going to go ahead and turn the event over to Robert.
Okay, good afternoon, everybody. So a couple of housekeeping things. What we're going to do, as we did last time, we're going to unmute everybody from our end. So as you have questions, you can chime in. What I would do, however, is mute at your end to reduce the background noise. So as David said, this is the second of two webinars. They're both recorded, so at a later date you can come and review them again. So Amanda's going to start, and I'm running the slides, so Amanda, you just have to let me know when I need to switch slides.
All right, let's go ahead and jump right in. So let's go on to the next slide. So just as a quick recap, so I think that some of you, if not all of you, had participated in the first webinar, but the intention is really to think about, in that webinar, and it's been recorded, as Robert had said, was to think about, all right, well, what is program evaluation? How and when and why do we use it? What are some of the methods that go into that and the types of evaluations we could consider? What are some evaluation frameworks and how do we engage stakeholders? And just really thinking about describing the program or project that you are thinking about evaluating so that you can create an evaluation that really makes sense. From there, we moved into what's the purpose of the kind of writing and concretely creating a purpose statement for that evaluation and some guiding questions. So what are the kind of questions that you are hoping that this evaluation answers? I will say this is a place where I think people often fall down because we know we want to do an evaluation, but we don't define those questions, and so it's easy to then kind of just be grabbing any kind of information that you can get. And then thinking about understanding and setting those program objectives, and this led us into a conversation about logic models, which is going to be really the biggest thrust of the conversation today. Next slide. So here we are today, and the intention of today's webinar is to, again, continue to review that logic model, to think about how logic models and program evaluations fit together, and thinking about those final components around program evaluation. So when we're thinking about program evaluation, and some of these things I kind of touched on, but not in a whole lot of detail in the first webinar, but thinking about where do we gather that credible data? How can we justify our conclusions? What are we going to do with this information? So how are we going to use and share the lessons learned? And what are our standards for effective evaluation? We're also going to spend some time today reviewing some examples of a logic model, and one of the main reasons that your line is unmuted is because we want the second half of today's call to be really highly interactive. So we're going to work through some examples and kind of create a logic model just in time. And then creating a program evaluation logic model. So next slide. So we talked about some of the standards for effective evaluation previously and thinking about the utility of that. So what are some of the uses of your evaluation, and how will you know how will you know that you're able to get the kind of information that you need? So thinking through the utility kind of also leads us into some feasibility questions. And so often when we're thinking about and we are creating a program evaluation, and I've sat on a lot of these myself, where we create a really strong and what seems to be an effective program evaluation, only to find out that the feasibility of this particular evaluation might be falling short a little bit. And so these are some things to think through as you're thinking about your evaluation. And when we think about feasibility, feasibility can matter in a lot of different arenas. And so feasibility might be slowed down by by just pure cost. Maybe you've designed a program evaluation that you can't afford, or feasibility might be designed or slowed down by manpower or resources. So you've got a really strong plan put together, but you don't have the manpower or the humans to physically move that forward. And so as we're thinking through our program evaluation, these are things that we encourage you to continue to think about. Thinking about the accuracy. So there is sometimes there's a little bit of a hang-up between the information that you wanted and the information you actually get, the information you needed and the information that you actually get, and is there a certain level of accuracy in the methods that you have put together. And so sometimes I think program evaluation can really get caught up in what is kind of the real world dilemma. So you think that you know exactly what it is that you are going to be collecting information on. Come to find out, the real world is a little bit different. And so when you go to continue that program evaluation, you can find some struggles there. The propriety, so the kind of the standard of the evaluation or the research that makes sure that the assessments of the program evaluation or project are conducted legally and ethically. This is often the first place that we end up in program evaluation, and I often get nervous here because we know that getting IRB approval can be something that is often a requirement, but often really, really difficult. But this is an opportunity to make sure that you're respecting the rights and the expectations of this. So again, thinking about utility as a standard of the evaluation of the research, ensuring that the assessments and the information of the program or projects are really meeting your needs. And then as you continue to work about thinking about the feasibility, so making sure that that's realistic and economical, keeping the ethical concerns aligned, and then accuracy, so making sure that the program or project is unbiased and that you have that accurate information. And I really encourage you to think about accuracy both as unbiased and making sure that your plan works out as expected as the program unfolds. Let's go to the next slide. All right, and so we have talked about this framework, and if you aren't familiar with this framework, I encourage you to continue to think about it and look at it. And so we just talked about the standards of program evaluation, and we know kind of circling this is the idea of engaging those stakeholders, describing the program, focusing on your design, what is this going to look like, gathering credible evidence, justifying your conclusions, and using those lessons learned. And so I will say for this webinar, we're going to kind of focus on the second half, which is what do we do with that evidence, how do we justify our concerns, our conclusions, and what are our lessons learned. Next slide. So gathering credible data. You know, this is something that I think we struggle with a lot, not because we don't have credible data, but because it takes us time to make sure that our indicators are set. We know exactly what our sources are. Sometimes in program evaluation, we set up really lofty goals for the kind of data we're going to get, and we find out that that is not feasible or practical, and so the sources of that data may not exist. And thinking about the primary and secondary data sources, and so as we're setting up this, the primary data are really the indicators that your organization or the people that you're working with have access to. The primary data is, it could be surveys, it could be observations, it could be focus groups, it could be interviews, it could be a variety of different sources, but they're kind of your primary source of data. The secondary source of data might be more public health data, so things that you could get from the census, the things that you could get from, let's say we're working at a college, so more population data, so the graduation data from colleges, or hospitalizations if you're working in the healthcare arena. But I often put this data in the population health arena, and so your primary sources of data are really close to the work that you're doing. The secondary sources say more about what's happening within a community or a population. What is the quality of that data? And so often when I'm looking at program evaluations, I find a lot of them that are heavily reliant on secondary sources of data. And now the quality of that data may or may not be strong. I think there's a debate at times about the quality of public health data, But the truth is that the quality of that data as it applies to your evaluation is sometimes really difficult because you kind of water down or muddy out your results. If you're looking at what happens for an entire population, but you've only interacted with, say, 10% of that population, using the entire population as your data source makes it difficult to tell if your program was effective. So I think thinking about the quality of that data, same thing with your primary data sources. So what are the quality of the surveys that you're using? Are they evidence-based surveys? Are they validated surveys? Is it a survey that you just created real quick and you're not exactly sure? So what is the quality of some of that data? And then quantity to me is a great conversation because there's only so much data we can collect, and sometimes in evaluations we get lost in beliefs that we can have as much data as we want, and this ends up often reducing the quality of the data. So thinking about the quantity as a way to really focus in on the things that you absolutely need to have. What are the indicators that are critical to this evaluation so that you perhaps minimize the quantity while also improving the potential quality of the data that you're collecting. The reverse that sometimes happens is that we have a very high quantity, but our quality at times can suffer because of that. Next slide. And then justifying our conclusions. So at the end of the day, this evaluation is not designed to be an exercise in busy work, and so we're doing this so that we can end up with some results that yield conclusions. What might we be able to do differently, better? Was this incredibly successful? Did we have opportunities where it could have been a little bit better? So thinking about analyzing and synthesizing both the data and the recommendations and coming up with an interpretation for that, because as the people in charge of a program evaluation, you are the only kind of closest to this work and able to kind of come up with that interpretation. Now, do people sometimes push back against your interpretation of the results? Absolutely. But I think it's our job to think through that evaluation and say, well, we can't just hand out results and hope people understand what they mean. I've sat in lots of meetings where I get a lot of data handed to me, and there's no interpretation and there's no analysis. And I think to myself, well, I'm going to walk out of this room and forget what it is that I'm supposed to remember about this data. It's just going to look like a graph to me. And there's going to be some judgment in that. One of the benefits that we talked about last time about external evaluators is you have less concern that the judgments or the opinions are influencing the outcome of that evaluation. But really thinking through, as you're analyzing and synthesizing the data, as you're kind of building the case for what it is that you found, that at the end you kind of come up with some recommendations. And thinking about those recommendations either for an organization, environment, I would also say potentially a population, that you have this idea of what exactly are the recommendations and the context behind that. What are the limitations to what you found as well? Next slide. Finally, it's the sharing of that. So evaluation reports are, I mean, it makes me sad when they're created and they just sit in somebody's kind of inbox or they sit on somebody's desk. So thinking about sharing the lessons learned and using these reports as a way to design potential future work in preparation for reporting out, giving feedback to the effectiveness of this work, and the feedback might be internally, it could be to your funders. Following up to those lessons learned, so is there anything that comes out of this, that next steps that we need to consider? And then finally, dissemination, and that's, I think, a place where we often fall down the most. And so we might think about designing and understanding the lessons learned and getting prepared for change and some feedback internally, but we don't always disseminate those results. All right, great. Thanks so much. I'll turn it over to you.
Thank you. So I know we went over logic models 2 weeks ago, and I wanted to go over it again. And as I said 2 weeks ago, there are a number of different iterations of logic models. Kellogg actually has a good one. Again, there are other ones. This one I'm presenting you has a couple things that are different than other logic models. One is sometimes they include program or project objectives, sometimes they don't. The big difference is that I like to have my logic models go from the objective to what data indicators and what sources you're going to use to get those data indicators, to really go from here's my objective and here's how I'm measuring objectives, so that if I'm an evaluator or I'm the project manager, I can see the direct connection. And we're going to go into each of these, again, briefly because we went through them last week. The program or project objective, what is that project trying to do? Now, that could be multiple things, and as you'll see in some of the examples we're going to use today, they are multiple things. You may have 2 or 3 objectives that are going at the same time, and you really want to evaluate them separately, and you want to use your logic model to kind of walk across each of the boxes separately. So for objective 1, and you'll see these in our examples, what are the activities, what are the outputs, what are the intended outcomes? Same thing with option 2 or objective 2. You know, what are the resources and activities and outcomes? Because they may be different, and I think it's good for program managers and project managers to really break out their logic models by each objective, and maybe a page for each objective. That way it's clear. Resources, and we'll go into this again in a little bit. What staff are you using? And I think as you think about resources, you know, it's internal and external resources. Are you going to bring additional money in or additional staff in to do something, or consultants? Are you going to go for other kind of funding? And then kind of the soft things of resources, your infrastructure. Are you going to need space for something? Are you going to need computer access? Those are all things you need to consider as you're going through. Activities are, what are you doing? What did you intend to do? So you're doing trainings, you're developing curriculum, you're having meetings, you're doing webinars like this. Those are the activities that your resources have led to. Now, once you've understood your resourcing activities, what are your outputs? And again, as I mentioned a couple of weeks ago, people kind of confuse outputs with outcomes. So your outputs are really, what did you do? I trained 20 people. I held 5 meetings. You know, 20 more people got served in my community health center. Those are your outputs. And they're going to be a little different than your impacts, because what is a result of your outputs? And let's talk about impacts a little and outcomes. So again, I changed my behavior. All of a sudden, I went to the FQHC more, and all of a sudden, I've changed the behavior. If I'm in training, I've now decided to go into primary care specialty. You know, one of the things that both Amanda and I did is we looked at different programs that you guys have run over the last number of years and really tried to understand how you, as people were responding, what were they saying they were going to change in terms of their outcomes? Again, how did they change their behavior, their skills, their knowledge, their status, or ideas? Again, so I'm going into primary care. I now have an understanding how to eat better if I'm thinking about diabetes. And also the objectives can be long-term and short-term and intermediate. So sometimes they can be within the first 6 to 8 months and going longer. And one of the things we talk about is you need to think about your outcomes, again, along short-term, intermediate, and long-terms. But that also depends on how long your project is. So one project, a short-term outcome might be 6 months. Another project, it might be a year or 2, depending on the length of the project and the type of outcomes you have. And finally, impact. And impact is kind of a consequence of your outcomes. If you think about accessing care, so I put more NPs into the community, people are now going to see the NP. One of the behavior changes may be I go to the ER less for, you know, avoidable ED visits. So what could be some of the outcomes? Maybe I have less ED visits, the cost of healthcare goes down. So you gotta think about a more long-term kind of consequence of your actions and how that impacted on somebody. So again, as you think about outcomes, what changed, and then what was I hate to use the same word again, but the impact of those changes. So again, I access care differently. There's now new training curriculum, things like that. Okay. The next thing in the logic model I want to talk about, and again, Amanda hit these a little, indicators and sources. So if I'm going to measure the number of people trained, do I use iPads data, which is graduation data? Do I get it directly from the school? If I'm going to look at a change in the number of people who access my nurse practitioner, do I go to the FQHC? So what data do I need to measure what I'm trying to do, and where do I get it from? And I would argue that when you're thinking about your indicators and your sources, you may be measuring both your outcomes and your impacts. And I think sometimes it's a little more difficult to measure your impacts, but you're talking more broad-based things like changes in how you use the ED. There's so much going on in healthcare, especially now, that sometimes the causality is going to be difficult to measure. But you need to think about those, and maybe you just measure your outcomes and not your impacts, or your measure combination. So I want to pause here. Again, give you guys some time to ask questions if you would like. And also, again, this is the logic model we're going to go through. And as you can see, I always think kind of linearly. So this kind of walks your way through from project objective, again, to your indicators and your sources. So if my objective was to increase the number of PAs in the community, then how do I measure that? And how would I measure the impact and the outcomes of that? So any questions? So just a couple of reminders. We have developed a evaluation manual that's being assessed right now by some of your staff. When we get final comments back, it'll be out for your use. So we're still waiting on that. And a lot of this is covered. So the things we've been covering for the last 2 webinars are going to be in there in a slightly more detail. One of the things we were asked was, as you think about a logic model, think about it both in terms of an individual project as well as a cohort of projects. Because as project officers, you guys may be asked about, so you've just put out an RFP or a request for application. And what's happening, they want to know, a year or 2 down the road, what happened with that RFA or RFP? Was it successful? So you're really not looking at one individual program, but you're looking at a cohort of projects and trying to understand whether that program, in essence, was successful. So the next couple of pages, I actually took an example from actually some of the work that you guys do, and actually tried to create a logic model of the project. And again, that logic model then could be used for creating an evaluation. So on the left-hand side, we've got a cohort of projects or a program. On the right-hand side, we've got a project. And as you can see, I worked our way through the logic model to give those. So in the first case, on the program side, we're looking at the primary care workforce and increasing the number of residency slots. Again, it's a number of projects or a program. On the right-hand side, which is individual project, we're looking at the same thing, but now we're looking at it individually. And as you can see, the first changes become the resources or the inputs. So if I'm thinking about it from an individual project, I'm really thinking about what I have to do as a project manager to get this project going and implemented. So I'm thinking about my grant funding. I'm thinking about the staff I have to use. On the right-hand side, on the left-hand side, I'm thinking about what, from a project officer point of view, what I need to do to help my projects implement their program. So it may be less project-specific, but more kind of process. So I'm making sure the money gets out. I'm making sure that whatever other resources are available get out. Staffing is up and going at the individual projects. So again, and I know this is a little more difficult to understand, as you're moving back and forth between the programs and the projects, but I try to give good examples. So when we go to activities, the same thing happens. On the right-hand side, where I'm thinking about the individual project, I'm thinking about those activities I'm doing based on the resources I've been using to implement the individual projects, where on the left-hand side, I'm really thinking about myself as a project officer and what I'm doing to help implement all the, as a program officer, thinking about all the projects I'm implementing. So again, my activities are I'm getting out the grant funding. I'm having to work with the individual projects on their work plan and their objectives. I'm having to look at status reports. I'm having to do those things as a project officer to manage the program and manage the individual projects. Any questions before we go on? Same thing with as we go into outputs, outcomes, and impacts. Again, on the right-hand side, we look at the individual projects. On the left-hand side, we're looking at a cohort of projects or a program. And interesting, I actually struggled with this part a little more because as I was thinking about an individual project, it's really easy to say my individual project is I'm increasing the number of slots by 20. You know, you can see all the different things that we've talked about. On a program side, it's a little more difficult because you're looking at a number of projects and all their outputs may be differently. So what you're really comparing their outputs to is not necessarily what they individually did, but did they meet their project objectives. So you're really thinking more globally than, again, the projects, you know, I had to do my 20, but did all of the projects as an aggregate meet their objectives? And then as I thought about outcomes, they really are the same things as well as impact. They really are thinking about, again, as you think about outcomes, did I change behavior? Did I change what people do? So we increased the number of residents that graduated from a program on both sides. We increased the number, which could be actually, you know, think about a short-term and a long-term objective. A short-term objective could be we've increased the number of residents graduating from a program. I'm sorry, outcome. There are a lot of these terms. A short-term outcome could be increasing the number of residents graduating from the program. But a longer-term outcome could be the number of primary care providers I have in a community. So as you start thinking about outcomes, what's short-term again, what's long-term, and from a program or a project point of view, they can be the same, although depending on the project, at least in this example, they say they were similar, but in other projects and programs they may not be. And finally, as you think about the impact, again, the impacts could be the same, but again, what's going on? So we've increased access to care for vulnerable populations. We've increased a population going to primary care, going to ambulatory care settings for primary care instead of the ER. We've reduced ER visits. You could even add, depending on this, a reduction in avoidable hospitalizations. So in the outcomes, again, we've changed behavior of our providers because that's who the project was focused on. And then our impact was we started looking more broadly on how that impacted on our community. Questions right now? Again, I know this is a little difficult, and I think it really needs to kind of think about, as I looked at some things, it is difficult at times to break out outputs from outcomes and impacts. I think you just have to think about what you're doing, what changes have happened to who you're trying to serve, and then what are the long-term implications. We got a question. Go ahead, Catherine. Go ahead.
Yes. Can you hear me?
Yes, I can.
Good. Okay. I had a question. If you could go
Sure.
back to the last slide, if you don't mind.
Sure. There you go.
Thank you. About the leap from outcomes to impact. So we know the directionality of the change in the outcomes. It's an increase because it was observable and measurable. The impact For example, you have here increase in access to care for vulnerable populations. That wasn't measured with this particular study or this particular project. To what extent can we attribute that to the activities and project whether it'll be an increase or decrease? That's where I always kind of run into problems.
And Catherine, you're not the only one. So do we. I mean, you're right. How do we measure an increase in population, increase in change? Because there may be so much else going on in your community and in healthcare that you're not sure what's cause and what's effect. I think sometimes it's just we know there's a change. We think that there is some kind of direction to it. You know, maybe you look at your outcomes and say, well, you know, I know that, you know, that 20% my FQHC or my community health center, I've got a 20% increase in the number of people going now. I've increased my patient panel. So you could say for that patient panel, you could actually track, if you could track them, you could say, oh, I've actually seen that I've got ED visits are decreasing, avoidable hospitalizations are decreasing. You could do it as a community-wide assessment. Yeah, I think as you said, it becomes a little more difficult to do cause and effect that way.
Right, right. I think in terms of my limited experience here with these, you know, so many of the BHW grants are training and education, and so we can talk about the changes and the experiences that the trainees coming through programs have gained, for sure. But then when we're asked to talk about how that's changing patient populations, it's sometimes a bridge too far. Yes.
Oh, totally. Because you just don't know, because you can put somebody in a community, and does that mean patients have really changed their behavior?
Right.
It's not easy, and not only is it not easy, but then trying to figure out a data set. So if I'm looking at, let's say, an increase in access to care for vulnerable populations, what data set would I use to do that? Now, I might use the behavioral risk factor survey that tracks, do I have a usual source of care? So in theory, I could look from one year to the next year and say, all right, I know I've got in this county, in this community, I've added 2 or 3 more providers, and I've seen maybe a measurable change. Now, again, you may not be able to do cause and effect. You just know that something's changed and you put 3 people there. There may be other data sets. I mean, again, that's very global. You could also go, all right, so if I know 20% in my patient panel is increased, can I track those patients? Can I go to the hospital or go to hospitalization data and ED data and say, all right, let's find for that 20% of patients that I know are now coming to my FQHC or my community health center whether I can track them and really see that. You're right, it can be a bridge too far because all of a sudden you're going past what you have a grasp on in terms of data and whatnot.
Right.
So it's not easy. You're right, because if I'm training a PA, I know the PA's come out, he or she has gone into primary care. I know he or she's now in a shortage area. I know all that. That's really easy to track. But then the impact sometimes is not. I've also seen logic models that really don't have impacts either. Sometimes they don't because of kind of issues.
Do they still have very lofty kind of goals from the outset? Because when you bookend it.
Right, not necessarily. So if my objective is to increase my residency slots in primary care, and I've added 20 slots, PGY 1 through 4, 3, or whatever, and that's happened, that's maybe what I measure. But again, you're not going to know. But what's the true impact on that because I have more doctors coming out? So it's not an easy thing to do, and it takes some mindfulness about both setting your goals as well as how to evaluate them.
Thank you so much.
You are so welcome.
Amanda. I'll say just really quickly, I completely agree with everything you've said, and this is something that I've seen just a big debate about, especially in your work and thinking through what is the true outcome. So we know that we want to prepare a better workforce, but thinking about changes in patient outcomes because of that is really difficult. Sometimes, although it might not fit into the program evaluation or logic model, I found just really small case studies as a way to kind of dive into that weed because they're time intensive, They're difficult, and of course you can't make a huge globalizations about it, but you want some sense of what's happening to patients. And so thinking about doing 1 or 2 case studies sometimes just helps you answer that question without feeling like you kind of totally ignored it.
Okay, thank you.
And let's go into indicators and sources. So actually that kind of, Catherine, your question kind of got to that. So as I said, we could understand how many people graduated in the community and how many people remained in the local community as from a project point of view, but what do you mean remained? Are we talking, you know, for shortage areas or for National Service Corps, you're 3 years and you're out. So do we look at 3 years out? Do we look at 5 years out? Because the impact and the outcomes may be short. Again, I put somebody in a community for 3 years, but if they're not there in 5 years, my long-term impact may not, or outcome may not be good. But if they're still there, I may not be around, you know, as an evaluator to look at what's going on after 5 years. So again, you have to think about your indicators and how to measure them. A lot of, especially in training, I like to look at multiple time periods after the intervention, essentially, especially where you've got a webinar or you've got something and they've got a new skill. So maybe they change the skill, you know, immediately after. When I do an assessment, I can see that they understand the skill they've learned. But in 6 months, 12 months, 18 months down the road, did they still remember and implement that? So it's something that I like to ask about, just because I think it's important to see if you've institutionalized the change, whether it's a skill or whether it's putting a physician in a shortage community. So again, your logic models, examples, or indicators and sources are going to vary depending on what you got. And again, we're talking about number of graduates. We could go to the residency program and ask who graduated. We can ask them if they track where their graduates go once they've done, and we can use that to, again, understand the outcome but not necessarily the impact. So before we go into, we got about 20 minutes, and I want to kind of at least start building a logic model from an example. Any questions right now? So one of the things that we sent to Robin yesterday that she circulated was I actually took a project proposal that someone had sent to HRSA, and I kind of stripped it down to take out names and also to kind of give a short view of how to build a logic model doing that. And oh yes, and if you don't have it, it's actually on the website that links you to this webinar. So, okay. So what I did is I actually took the logic model and put it into Word so we could go through it. And this is where I really would like some input from you guys in terms of helping to build a logic model. So I'll just read the first part, what the introduction to this project was. The overall goal of the project is to expand the breadth and depth of physician assistance training in primary care to improve patient access to care and to address the Healthy People 2020 goal of reducing health disparities. This project actually was in upstate New York and focused on getting veterans into the PA program that was in upstate New York. Do people have that in front of them where they can actually kind of throw out things? So again, what I'd like people to do is throw out what they think the first objective is. And then we're going to walk our way through it. All right, so let's walk our way through. And again, this is available on the website, and you can see how we do this. So the first thing is my typing is going to be atrocious doing this doing this live. So this is going to be increased recruitment from veterans into the PA program. So essentially, this organization said that they could go to the local fort that was around and talk to veterans who have been medical assistants and get them into PA programs. So they want to increase recruitment. So what are some of the resources they would need? So I would say staff time to visit the fort, resources to develop recruiting materials. Sorry about my typing. Can anybody think of any other resource? Actually, I know that a lot of times when soldiers are coming back from the field, that they include these forms to help them look for jobs. So this might be one place you go. So staff time to visit the fort, go to maybe create some recruiting materials, including some web-based materials, and then go to some of these forums and other type of seminars around recruitment. So what are the activities? So I would say the activities for this one are visiting the fort. I'd say a web page development. I would say some recruitment brochures. So those could be some of my activities. So as you can see, as I've thought about it, I've put staff time in, and staff time is going to lead to all these different activities. Does anybody think of any other activities that you might want to use for this job? Again, so as I've thought about the objective, this is very specific to this program. I want to get more veterans into the program, so I'm going to focus my resources on things, and then the activities are going to come from the resources. So let's think about what our outputs are going to be. So our outputs are meetings, provide recruitment incentives. Okay, so let's add resources, some dollars, and we're going to create some recruitment incentives. So we've got meetings, we've got a web page, we've got a brochure, and how about a newsletter? So we've just now added, our outputs are meetings, so maybe we should be more specific. We want, let's say we'll do 5 meetings at the fort. We'll do a web page directed to returning soldiers. We'll do two employment seminars, and we'll create, let's say we'll do $10,000 in financial incentives. And we'll identify, let's say, $2,000 a person, so we'll do 5 soldiers. So, I mean, all these are really interesting, and it's kind of, we got to remember, we've got to get back to the objective of the program. And the objective really was to increase the number of soldiers going into the PA program by 5. So let's look at some of the outcomes we have. So, going back to our objective, which was to increase our PA program, partly focusing on soldiers, let's make that an outcome that we want to look at. So we want to look at the number of soldiers going to the PA program by 5. We want to increase the number of soldiers that are going into primary care, and hopefully we'll increase the number of PAs that are going into shortage areas. So those are, one of the things that I talked about a couple of weeks ago when we talked about objectives was making them measurable. And it's the same thing with outcomes. As you think about outcomes and think about outputs, they both really have to be something that's measurable, something that you can say, I need to understand if something happened. The example I think I used last week or 2 weeks ago was staffing satisfaction. That's something you can't really wrap your arms around. So you really want to make your outputs, I'm going to do a newsletter. I'm going to do a quarterly newsletter. I'm going to do a brochure. I'm going to go to 2 employment seminars. Those are really stuff you can measure. Same thing with your outcomes. What are you going to measure? And in this case, we increased the number of soldiers that went into the PA program by 5. we increase the number of soldiers that decided to go into primary care, and hopefully we increase, and again, you could argue short, intermediate, and long term. So my short term is I've increased the number of soldiers in the PA program, which is a very good short-term goal. And in the long term, I've increased the number of PAs that have gone into shortage areas. And then my impact, and we've kind of gone over this already, the impact could be reduction in ED visits for primary care, increase in the number of citizens with normal, usual source of care, and a reduction in avoidable hospitalizations. So I've taken, should have had somebody else type for me. So I've taken my outcomes, my very short-term outcomes of increasing the number of people in programs, number of PAs going into community, partly through recruiting soldiers, and now I've thought more broadly about the impact, and the impact, again, as we've talked about, is very broad. Now, it's not necessarily that easy to measure those things as you'll think about it. You know, those are long-term. There are a lot of things that may be going on in the community, but those are ways to think about it. So, any questions? Again, I wanted to go through this. This was a very basic proposal someone had sent to HRSA a couple of years ago that I wanted to go through. Amanda, do you have any thoughts on any of these things I wrote out?
No, I really liked how you specified, like, the outputs need to be measurable. I think sometimes we consider just the doing of making a brochure the output, but, you know, how often and how many seminars, and so I think that was a really great point that you clarified.
Yeah, right, and even with the brochures, while I didn't really specify, you know, is it one brochure, is it multiple, you know, how do we distribute them? You could actually argue that just, you know, having a brochure isn't enough, that maybe we talk about how they get distributed.
Right.
Again, our outcomes, how they're measurable, and you can go back either through the program or something else to measure it. Again, the impacts are more long-term, but it also gives you a sense of where you're going with this project. I was kind of hoping to get to a second example, but I know that I don't want to keep you guys from your work as well as us here from our work. Are there any questions? And again, we're going to, all this, we'll put this online too, this logic model example, as well as the proposal we put down, so you can kind of see where I'm going. And again, you know, this was just off the top of my head based on kind of a very sketchy overview of what the program was. And obviously more depth, if we had more depth in the project narrative, we could have gone more depth in the logic model. But again, as you can see, I can use now the outcomes and say, and actually the next step would be indicators. So I could argue that my indicator would be graduations, my sources would be the local college. Other thing could be the number of providers in a community could be an indicator. I could go use New York State licensure data. And then if I really wanted to get ambitious, I could talk about, increase in, increase in usual source of care, and I could use BRFIS for this. You know, so again, I've thought about that some of these, especially these impacts, can be difficult to measure because they're way out. But again, it gives you some ideas. You walk through this, how you can go from the project objective and actually find some indicators to measure whether that project objective was successful. And again, this is a very brief overview. If you think this is useful and we can do it with a specific project or two you have, we can do that. We'd be happy to do that. Are there any final questions? I do want to thank you, and I know that this stuff can be very dense and difficult to follow. I think that when you get the evaluation guide, you'll be able to track that and kind of go through this same process and understand it better. But I appreciate your time, and we do appreciate you being on the phone for this hour. I know that, again, you got a number of projects, and as do we, and these kind of things can take you away from the fire on your desk. But we do appreciate your time. Again, everybody, thank you very much, and have a good day.